Hi all, I'm Dr. Malati working as a professor in Tripoli College of Nursing. So in this video, I'm going to discuss about the chorionic villi sampling. The objectives are introduction, definition, indication, time period, pre-procedure, procedure, post-procedure, risk and complication, summary and conclusion. Introduction. Chorionic villi sampling is an early prenatal test can be done between 10 to 13 weeks of pregnancy to detect the genetic and chromosomal abnormalities. It also involves taking a small sample from the placenta. It helps to identify the conditions like Down syndrome. Here the nurses plays a vital role in patient preparation, support and monitoring for complications. Definition. An invasive prenatal diagnostic procedure helps to involve the biopsy of the chorionic villi, which is nothing but the placental tissue. Indications. Indications for the chorionic villi sampling is performed for prenatal diagnosis of fetal chromosomal or genetic abnormalities. So, it includes increased risk of abnormality can be identified through the antenatal screening. That is, the risk is more than 1:150. Or the second indication is a previous child with chromosomal or genetic abnormality. Third one is if there is any family history of genetic conditions or any ultrasound evidence of fetal abnormalities that are associated with chromosomal or genetic conditions. Next is the abnormal first trimester screening results. If mother shows, if she has undergone any investigations and if investigation shows any abnormality during the first trimester means we can make a mother to undergo a chorionic villi sampling. Next, if there is an increased knuckle translucency or any other abnormal ultrasound findings means we can make a mother to undergo a chorionic villi sampling to confirm whether the fetus has developed a chromosomal or genetic abnormalities. Procedure. There are two types of procedure can be done. One is transcervical, second is a transabdominal. Transcervical can be done between 10 to 12 weeks and transabdominal can be performed from 10th week of gestational age till term. Pre-procedure should get an informed consent from the patient, provide a psychological support, make sure the bladder is emptied for the abdominal ultrasound, monitor the maternal vital signs as well as the FHR. An abdominal ultrasound is performed to determine the position of the uterus, size of the gestational sac and position of the placenta within the uterus, followed by vulva, vagina, cervix and abdomen are to be cleaned with an antiseptic solution. Transabdominal. Maternal abdomen is painted and draped. 18 to 20 gauge disposable spinal needle with adequate length, that is 7.5 to 15 millimeter is used. Needle is passed through anterior abdominal wall into the substance of chorionic frontosome under the guidance of USG. Thereafter, the stellate is withdrawn and the 20 ml syringe is attached. Gentle pressure, that is the negative pressure, has to be created with the movement of up and down. The person who is performing the procedure has to take care to avoid puncturing the fetal aspect of the amniotic membrane with the guidance of USG. Thereafter, the tissue is then transferred to the culture medium containing tubes or petri dish and examined for the adequacy of chorionic villi before the needle is withdrawn. Next method is transcervical. Maternal abdomen is painted and draped. Vulva, vagina, cervix and abdomen are also cleaned with an antiseptic solution. A long malleable polyethylene catheter is introduced through transcervically along the extraovular space under the ultrasound guidance. Few villi can also be collected from the chorionic frontosome. Then the tissue is transferred to the culture medium containing the tubes or petri dish and examined for the adequacy of the chorionic villi before the needle is withdrawn. Post procedure, monitor for vaginal bleeding, abdominal pain or cramping, assess for leakage of amniotic fluid, Check for maternal vitals after the procedure, then administer the anti-D immunoglobulin 50 microgram IM if the mother is Rh negative. Risk and complication, miscarriage 3 is to 1000, 1 to 3%, bleeding 1 in 10 women, infection chorioamnitis, leakage of amniotic fluid, rare risk is limb reduction defect if the procedure is done before 10 weeks of gestational age. Patient education, instruct the patient to report if she develops any fever, heavy vaginal bleeding or any amniotic fluid leakage. Advise the mother to take rest for next 24 to 48 hours. Avoid the strenuous activity or any sexual activity for next weeks. Summary, chorionic villi sampling is a prenatal diagnostic procedure performed usually between 10 to 13 weeks of gestational age. It involves collecting a small sample of chorionic villi from the placenta through a trans-abdominal or trans-cervical approach under the ultrasound guidance. CVS is primarily used to detect the chromosomal abnormalities such as Down syndrome, Edwards syndrome, and genetic disorders like cystic fibrosis. It also provides the early and accurate results, allowing the timely decision making. However, it carries certain risks such as miscarriage, infection, and bleeding. Conclusion, chorionic villi sampling is an important early prenatal diagnostic tool that helps in identifying the genetic and chromosomal abnormalities at an early stage of pregnancy. Despite its invasive nature and associated risks, its benefits in early detection and informed parental decision making are significant. So, proper counseling, skill technique, and careful monitoring are essential to ensure the safety and effectiveness of the procedure. References. Thank you.